Ask AJ. Hi, everybody. Welcome back to Ask AJ. I'm AJ Hanna from Sykes, and today we're going to talk about a topic that I've been spending a lot of time looking into over the last few months, and that's telehealth. My first exposure to telehealth came when I worked as a claims processor in the American Medicare insurance program, and Medicare created coverage for people primarily in rural settings to be able to get access to specialty care that maybe they didn't have in their local community. And telehealth really isn't new. It's been something that in one form or another, providers, doctors, caregivers have been reaching out to peers or specialists in a particular area via some electronic means for decades. It's only been within the last several years that we've seen an advance in using audiovisual equipment in order to be able to assess someone, remote monitoring equipment to be able to assess vital signs and the current condition of a patient. But the problem is that there have been a lot of things that have been layered over top of telehealth that has restricted its ability to perhaps be as effective as it could be. Not the least of which being limitations on coverage. Again, traditionally in Medicare, it's only covered within a care setting, and it's only covered for a patient who is in a rural or underserved areas. There are the issues of licensure for caregivers crossing state lines, and is it possible for a caregiver, say in the state of Indiana where I am, to be able to provide services to someone in the state of California? Well, it all depends on whether or not the licensure requirements, local regulations are consistent, and reimbursement hasn't always been encouraging or as enticing as it is to see someone in person. And if COVID-19 has done anything within the healthcare space, the ability of telehealth to play a major role in allowing people to get care across a much greater expanse of conditions to avoid having to go into a facility where the potential to spread the virus is more substantial, may drive telehealth to finding its day. Many things have happened from a regulatory and a legal perspective, with states waiving certain requirements about how and when telehealth can be used. We're seeing an increase in the number of people using telehealth for routine services as opposed to things like mental health, or telestroke is a very common usage for people who are perhaps in the early stages of having a stroke. Telehealth is used extensively there. So we're seeing more and more use of routine and more common treatment options or diagnostic options that you see normally done in a clinical setting. Reimbursement has increased in some cases to come closer in par to what an in-person visit would pay. And really, as we've grown as a society in terms of our expectations and our use of technology, the market's going to have to respond to the convenience factor, certainly the safety factor that comes into play with being able to do a visit with a caregiver from the comfort and the security of your own home, as opposed to having to go into a hospital or a doctor's office. And we'll continue to see, I believe, more expansion of what things can be done from a telehealth perspective. Right now in the United States, there are a number of senators at the federal level who have petitioned the Department of Health and Human Services to make permanent the relaxed standards and expectations and guidances around how telehealth is used. We expect many states to do much of the same thing. Colorado is already beginning to look at keeping some of the ways in which they relaxed their regulations and guidelines for use of telehealth long term, which will require legislative action. And we will see that more and more people who perhaps had never considered telehealth because of the comfort level that's involved in having a face-to-face interaction with your caregiver will take the opportunity, or have taken the opportunity because of COVID, to find out how convenient and really how much can be done in a telehealth visit. At Sykes, we did a survey back in March, right at the beginning of the coronavirus pandemic, when things were starting to restrict with travel restrictions and lockdowns. And what we found is that the vast majority of people that we had surveyed had some knowledge of what telehealth is, but had never had the opportunity or never taken the opportunity to utilize telehealth. And so with coronavirus and with the desire to socially distance from other people, what we found is a willingness or much more openness to the idea of doing care remotely. And the concerns are mostly what you would expect to be concerned, whether or not you can get the kind of care and a remote visit that you can get, and an in-person visit, whether or not you do the telehealth visit and you still have to go in and see the doctor, and that's certainly something that could happen. But we know that people have considered the use of telehealth much more extensively because of the current pandemic situation, and my expectation would be is that will continue on even past when we have breached whatever the current level of impact of the pandemic will be on us within the foreseeable future. It makes sense. It's good use of technology. There are concerns. You certainly have to be concerned about data security and so on, but I think we're going to learn tons in this time period, and have learned tons about how we can secure and make sure people's privacy issues are addressed. And so we'll continue to see an expansion of telehealth. Would love to know what you think. If you've had the opportunity or know somebody who's had the opportunity to engage in a telehealth visit, drop me a line at askaj@sykes.com. Follow me on Facebook and Twitter at AskAJHannah, no H on the end, or leave a comment either in LinkedIn or in YouTube. Would love to hear from you and what your experiences or your questions might be. And so until next time, take care, and we'll see you soon.